Good morning.
Good morning.
We are from Team Quick Review. We are back with more questions on COVID.
My pleasure. Shoot.
How should mothers take care of newborn babies in this season?
That's a very good question, Preeti. I think you should actually follow certain precautionary measures to take care of the newborn. First of all, normally we do vaccination at 1.5, 2.5, 3.5 months. So for now, I say for 1 or 2 weeks we can postpone the vaccination because we are in the phase of social isolation and more cases are cropping up in the hospitals. So please wait, don't rush to the hospitals for elective vaccination. First thing. Second thing, please breastfeed your child even if you are having a certain small cold or cough. Mostly you are not having COVID, but in the fear of COVID, if you are not breastfeeding your child, you are not giving the immunity to the child. Suppose if you are really concerned, please wear a mask or cover yourself properly with a cloth and then continue to breastfeed your child. Third, this being summer, is there any need to give any sugar water or additional water to the child? No, absolutely not required. By giving outside water, the child is at risk of acquiring the COVID infection even through oral route. Certain babies, especially compared to the adults, babies can present with symptoms of stomach flu. Likewise, even COVID can also present with symptoms of diarrhea. So please don't give any water additionally. Breastfeeding is sufficient. Then coming to the oil baths, head baths, please avoid giving all of those things. Normal bath, or if you think it is too cold, even sponging daily or on alternate days is sufficient. Otherwise, a quick lukewarm water bath is good. Then powders, I always say please do not go for powders. Moisturizer is good enough. And then please clean the entire house nicely with Dettol. You may add a little bit of Dettol to the bathing water also. So this is about it.
Thank you, madam. Are newborns are higher risk of corona?
Okay, newborn babies, yes, they are having lesser immunity, but the mother can transfer her immunity, that is the disease fighting capacity, to the child through breastfeeding. So that's why please give breastfeeding. That is what I have been emphasizing. Don't take the baby outside. Don't allow visitors. See, the baby had been in utero, in your tummy for 9 months. They can wait for one more month to see the child. No, they don't have to fly internationally to come and see their nephew or niece. They can wait for one more month. Please don't celebrate anything yet. And then preterm babies, yes, that is my whole point. See, this coronavirus has a specific knack for attacking type 2 cells that are present in the lungs. What does this type 2 cells do? This type 2 cells releases a surfactant, which is something you can compare to an oil in an engine. When you put a drop of oil, the engine runs very smoothly. Likewise, this surfactant is a thing that is produced by the lung so that the process of expansion and contraction of the lung goes smoothly. Now what happens? If these cells are affected, the lung doesn't expand very nicely. It becomes stiff. Okay, so that's why the elderly people are not able to breathe. There is a lot of oxygen in the lung, but we are not able to utilize because the lung is not expanding right. Okay, normally preterm babies are also born with a deficiency of these kind of surfactant cells. Got it? So these babies are at a higher risk. If a preterm baby develops corona, it is going to be really bad. So please take extra precautions when you touch the baby. Use hand sanitizers. Please wear masks and avoid visitors. Always, prevention is better than cure. Stay clean, stay healthy.
Okay, thank you.